Hi everyone, here we are today with this patient. She is suffering from more than 20 years with pain on her right side of her body. Can you show us what's going on and where is this pain?
Sure. So the pain is all on the right hand side, from the head down to the neck, into the lower back on the right hand side, and all the way down into the knee on the right.
Okay, so when she was 12, she was seen by a doctor, probably a consultant, and she found out she had scoliosis. Definitely you have scoliosis, I already checked. Now I will show you some tests that I usually do with people with this kind of condition. I will do a treatment and we check at the end if there is any better in terms of mobility. Okay, so the first of those tests, if you look at the shoulder, this shoulder is a little bit different in level. Okay, if I try to push the shoulder down, this is how it reacts. If I push the other one, it's a little bit more stuck. Okay, now can you show us how you bend the neck on a side? Just look at the neck. And the other one? Okay, this side the neck doesn't bend over the right. Now can you show us how you bend all the body? Okay, and the other one? Okay, do you feel a difference?
Yeah, it's much stiffer going this way.
On the right, so the neck and obviously all the spine have more restriction on moving toward the right. Now, I will also show you a few tests that I'm doing while the patient is on the back. Can you please
Sure.
go on your back? Okay, so I usually check all the spine, whatever is the condition, if it's a pain on the knee, on the shoulder, or in this case the pain is quite extended, doesn't matter. I always check everywhere. Now, I start with the lower back. I usually grab the spine and I try to move the spine toward the right, toward the left. The patient has to feel differences because this different, then we hope they will improve after the session, okay? The mobility has to increase. Now, relax. This is how the spine moves toward the left and this is how it moves toward the right. So, basically, going right to left is a lot more stiff than going left to right. I will show you on the pelvis. If I grab the pelvis and I move the pelvis in this way, okay, and this way is a lot more stiff than this way. Okay, you feel it.
Yeah.
Now, let's take another joint, the hip. I usually grab the leg and I do an internal rotation of the hip. This is the left one. Look at the feet. And this is the right one. Okay, it's completely different. You feel the stiffness. So, there is an imbalance. Do you expect this imbalance on a person with a scoliosis, but you don't know even a person without scoliosis has similar things, maybe a little bit less evident, but we lose a balance for a series of reasons, and mainly injury, operation, it can be a car accident. Now, on a scoliosis, no one knows where the scoliosis comes from, but what I always do with any kind of patient, I try to understand where I feel the main restriction and I just treat them. Okay, let's go to the neck and to the head. Now, I already checked this patient. On the very top of the neck, if I move the neck from right to left on the top and from left to right, I can feel this side is a lot more stiff. So on the left doesn't bend the neck and it bends more here. She has pain on the right when I do it on the right because the right side is the one that moves the most. Movement. To have pain, usually the area moves. Okay, if we go on the lower part of the neck, it's completely the opposite. So while this part doesn't move, the lower part moves a lot. Okay, and the other side doesn't. The shoulder as well. This shoulder moves a little bit better and this shoulder no. Also, this shoulder, the right one, is a little bit forward. This is what you expect in a lot of people, not only because she has a scoliosis, okay? Now, after all this test, I already asked the patient if she had some injury, especially when she was very, very little. She doesn't remember a lot. She played volleyball. Do you recall any injury?
What? Yeah, I had a lot of injuries. I'd often fall on my knee, hurt my knee. I'd hurt my my butt cheek. I'd hurt my quads. I also went snowboarding and fell my my right elbow a couple of times. So yeah, a few injuries from sport.
Okay. Also, she had one operation only. When she was like 13, she had an operation on both here. Okay? Now, I already checked. I feel the most of the restriction on this part. Okay? I have a model of skull, and especially on this area, on the right side of the occipital bone, is called. If I try to lift the skull in this way, on the left, it moves quite well, but if I do it on the right, it doesn't move at all. So I grab the skull from this area, from the sub-occipital muscle, I push on one side, it moves, the other one, it doesn't. Okay? Now, I already know, I suspect she had an injury when she was very little on the occipital bone, right side. She doesn't remember, but you need to consider kids and fall on head are a very common things which happen to every of us, okay, when we are very little. So now what I can do to help this patient with this condition, she's suffering for 20 years. Now I already know, she also had some operation on the mouth, on the teeth. She removed a couple of teeth on the side. Now I already know I would like to start from this. I would like to release tension that arises from the right side of the skull, around this area here. I will do a treatment. The treatment is very light. It may be long, so I won't show the treatment, but basically I will grab the head like that and I will try to do some light manipulation around the suboccipital muscle just to release them, okay? This treatment can last 15-20 minutes, so I won't show the treatment. It doesn't matter. What matters is if there is any change at the end in terms of mobility, okay? I will return soon after the treatment and we'll check again all the tests if there is any change. Here we are again. The treatment more or less lasted around an hour. We already did the test. It seems something changed, but while I was doing the treatment, she remembered another injury.
Yeah, I remember when I was about 8 years old, I was on rollerblades and I slipped on them in my kitchen and landed flat on my coccyx.
Okay, the area is a little bit on top of the coccyx. It's called sacrum. No one knows this bone, it's quite big, but it's very common to land on this bone because it's very exposed. So when you land, usually you injure this area. Now, we will do the test again on standing and on the bed, and we will have some comment from it. Okay, now at the beginning I show you how I was pushing down the shoulder, how they were moving. Okay, this is the left one and this is the right one. Okay, now can you show how you bend your neck on a side? Okay, there is still a difference on the right. The right is a little bit less flexible. No, not many people knows, but an injury on those structure, coccyx and sacrum, can affect all the spine. So because I know there is still this injury to treat, I wouldn't expect a full range of motion on side flexion. Okay, I wouldn't expect from now. And can you please lie on your back? Now, the biggest release when I was treating, basically the treatment involved me contacting the top, so the head and the bottom. I felt a lot of release on the top. So, in fact, if I now move the top of the neck from left to right, the movement is a lot more flexible than before. This side before was the difference left and right was a lot bigger. This side was painful. The right side was painful, was more flexible. You usually get the pain where the area moves the most, but it's not aligned. It doesn't work properly. This side improved the mobility. This side is more solid now. She doesn't feel a lot of pain when I do it, which is very good. Now, let's do the test on all the spine. Okay, now, this part is the one still having a little bit of trouble going toward the left. This side is quite good. And the pelvis. Now, this side was good before as well, okay? But this side was completely stuck, okay? Now, this side moves better. I know it's not 100%. Let's check the hip. What happened on the hip? 1 and 2. It moves better. It's not 100% as I expect. No, the next treatment will happen in 2-3 days. I will go underneath the pelvis and I will try to do an alignment. It will last probably 30 minutes. I need to feel a release. I need to feel an improvement in the mobility. Okay, I already expect something. Something will change from this therapy alone, but it's not enough. We confirm there is something. She recalled this injury, so we need to take care of it. And probably after the next appointment, the condition will be quite good. We will do again all the tests before the treatment and after the treatment. For the moment, thanks for watching.